Hello everyone, this is Stuti Singh. Today we will deal one of the important topic of fundamental of nursing, which is bed making. What is bed making? Bed making, it is a technique of preparing different type of bed to make patient comfortable according to his or her position. Or we can also say that it is a process of preparing different type of the bed, neat and clean bed to the patient in the hospital. Next is purpose. What are the purpose of bed making? Purpose include to provide a comfortable bed to the patient, to ensure good sleep of the patient, for the observation of the patient, to prevent the bed sore of the patient, or to maintain a good relationship between the nurse and the patient, and to teach the relatives how to take care of the patient at home, or to give a clean appearance in the ward. Next is the principle. There are some principles of bed making. First, microorganisms are found everywhere, on the skin, on the articles and the environment of the patient. So the nurse must take care to prevent multiplication of these microorganisms. Second is a systematic way of functioning will reduce time and effort. And third is a good and comfortable bed will ensure rest and sleep and prevent from many complications in the bedridden patient like bed sore and the food drop. And the fourth is good body mechanism, maintain a good body alignment and prevent from the fatigue. And the next is what are the some principles of the body mechanism. Firstly, while we do performing the bed making, we have to maintain the body mechanism. Next is always use your larger muscles than the smaller one. And the third is pull or push rather than lift, because it requires less effort, and always work in a systematic and rhythmic way. Use your own weight to counterattack the weight of the object. Next is there are some basic guidelines of bed making. While we doing any procedure, there are some rules and regulation and guidelines. So what are the guidelines of bed making? Firstly, we have to perform hand hygiene before and after the procedure. Next, assemble all the articles before the procedure. Never put clean or dirty linen on the patient's another patient's bed. Never put dirty linen on the floor. Always put on the hamper. And then last is make a ward comfortable to the patient and a uniformity. There should be a uniformity in the ward. Next is what are the types of bed? There are various types of the bed according to the condition of the patient and her situation. The bed include open bed, closed bed, admission bed, occupied bed, and then post-operatively bed, amputation bed, fracture bed, blanket bed, divided bed, therapeutic bed, and then the burn bed. We will deal one by one. Firstly, what is open bed? Open bed is a bed made to receive the client, either a client is coming from the ambulatory. Then next is the closed bed. Closed bed is made for the patient when the new patient is coming, and the closed bed is completely closed by the counter pan to prevent the dust and dirt. A closed bed is converted into the open bed when the patient inside in it. Third is the occupied bed. Occupied are the bed made for those patients who are unable to get off from the bed. So occupied bed are made when the patient on the bed. Then next is the post-operatively bed. Post-operative bed are those bed in which the patient is recovering from the anesthesia following the surgery. Next is the cardiac bed. Cardiac bed are the bed mainly made for the cardiac patient to relieve the dyspnea. In this, a cardiac table is needed. Then next is the amputation bed. The name suggests amputation. Means in this bed, the bed is made from the blanket. The blanket is divided into the two parts to visualize the amputated part of the patient without any disturbance. Next is the fracture bed. As name suggests, fracture. Fracture bed is made for the fracture patient or any bone deformity patient to make a patient table comfortable or to provide a firm surface to the patient. Next is the blanket bed. Blanket bed is made for the patient of renal and rheumatic disease to make patient warm and to induce the sweat. And the last is the burn bed. Burn bed are the bed which is made for the burn patient, and the bed cradle is used in this bed. And the admission bed is made for the patient newly admitted patient. These are the types of the bed which are used according to their situation. So in today's class class, we will discuss about the what is bed making, what is the purpose of bed making. There are some principles of bed making and some general guidelines of bed making and types of bed. I hope you will easily understand about the bed making. This is all for the today's class. Thank you.